Hello, I'm Dr. Vanessa Milongo and I will tell you our French hospital experience with DEBRICHEM. So who are we? We are a medical, vascular medical department of 55 beds in a private non-profit hospital. We have a strong focus on the management of chronic wounds, in particular through our Healing Institute, Jean-Paul Belmondo. Like all of you, we are confronted with leg ulcers that are refractory to our various healing techniques such as dressing, negative pressure therapy, screen graft, etc. This is a reason why when we were presented with the DEBRICHEM product, we were up to use it, and we did an observational study with the objective to evaluate the granulation of vascular ulcers after using this innovative device, with one hypothesis that biofilm was responsible for the failure of our leg ulcers to heal. So we included patients with vascular leg ulcers and inflammatory ulcers such as pyoderma gangrenosum likes. And all these patients had a non-healing despite our usual care protocols. We excluded patients with severe arteriopathy and critical limb-threatening ischemia and acute infection requiring systemic antibiotics therapy. Our primary outcome was the evaluation of ulcer granulation rate at 1 and 3 months. For the result, so we included 38 patients from September 2022 and November 2023 in the vascular medicine department in Paris Saint-Joseph Hospital. Our population was at a median age of 71.5 years old. It went from the young patient of 28 years old to an older lady of 94 years old. We had a prevalence of venous limb ulcers, and the time of evolution of our ulcers was from 94 months, which is about more than 7 years. All our patients had comorbidity, and we had PAD. We also had inflammatory hematopathy and cardiac disease. What we saw that all our patients already had, prior to using the DEBRICHEM, they all had a screen graft, which is like a trademark for us. And almost all the patients had already received at least one systemic antibiotics prior to using the product. At the first month, we had a 52 rate of granulation. In month 3, we had an increase of this rate, and it went up to 75%. This was one of my favorite patients who had a history of 35 years old venous leg ulcer with a recurrent infection. And as you can see, when we applied the DEBRICHEM, this is the result in the middle at 1 month, and 3 months later, the wound almost healed completely. We didn't have any serious complication. The only minor complication that we had was pain in the majority of our patients. This was controlled by the application of a local anesthesia and the low dose of opioid drugs. For most of the patients, pain lasted 2 hours after the application, and after that, the patient never testified of pain. To conclude, we can say that it's a safe device with no major risks. What we observed is that the granulation response can be delayed. So is it a long or medium-term action of the product? We also observed a reduction in the inflammation of the perilesional skin, which led us to healthier ulcer, transforming a chronic wound into an acute one, and thus restarting healing of our chronic leg ulcers.